Promoting balanced facial growth in children.
Facial growth and actually the growth in children is very important because we have very limited time to treat it. Most of the time what I see in the conventional doctors is that they said it's too early to treat this malocclusion or to treat this bad bite because not all of the teeth are erupted. But think about when all of the teeth are erupted, this kid is already to the end of the growth, so we cannot affect that much the growth of the kid. So it's very important again to concentrate to the source of the problem. And mostly I concentrate into the facial bone development and facial and bone growth. For me it's very important the kid to grow symmetrically. Also I work in a team with osteopaths and maniotherapists which check the rest of the body like the craniosacral breathing, also the atlanto-occipital joint, pelvis, feet. This is very important because when we change the bite, we actually change the connection between those two condyles related to the rest of the head. And actually, if we don't center that part, we create compression in some of the joint, which again from there are moving the rest of the bones from the head and create asymmetry. This is like in a very simple way that I try to explain, but just keep in mind, we can always move teeth around, even though the patient is 60, 70, 80 years old, as long as the patient has bone and teeth. But the most important thing is that we have to be concentrated to develop the bone in the right way. What I mean, for example, if we have narrow upper jaw, if we concentrate to move the teeth and bring the teeth back, we will not treat the problem because most of the time the narrow upper jaw is related to the bad tongue posture or bad breathing or some kind of other habits that the patient has. That's why if I see this kind of problem, I always refer the kid to the speech therapist or myofunctional therapist to reactivate and to train the muscles, so the muscles from their side will guide the growth as always. And what I mean for that, I mean that if we have hyperactive buccal muscles or hyperactive lip muscles, this will create actually a pressure to the bone and the bone will be redirected to this position. So that doesn't make sense for us to move teeth. It actually makes sense for us to re-educate the muscles so we don't have hyperactive and hypo or low active muscles in the other side of the teeth. So we have to have balanced muscles from outside of the teeth and from inside, and all of the function have to be very good so the kid develops very well. So for me, using rapidopalatal expanders, any assisted surgery expanders or any other appliance that directly can break the sutures in the upper jaw in maxilla, it's not needed, because the only thing that we have to do is just to eliminate the problem and then guide very softly and gently the growth of the kid.